Have you ever paused for a moment and truly considered the delicate balance that governs the health within your body? The silent symphony of organs working tirelessly, often unnoticed, until a sudden challenge forces them into the spotlight? Among these, the kidneys play a pivotal yet understated role, filtering life's impurities, regulating fluids, and maintaining a harmony that allows every other part of you to function with precision. Yet, when medical interventions become necessary, even tools designed to heal, like imaging contrast dyes, can present a paradox, offering both clarity and potential risk. It is in this very intersection of necessity and caution that the true responsibility of self-awareness emerges, compelling each of us to become an advocate for our own health. Inspired by the teachings of Dr. Mathew R. Weir, we are reminded that knowledge is not merely power, it is protection. Every scan, every test, every procedure carries within it a question that must be asked, a history that must be shared, and a dialogue that cannot be overlooked. The moment we recognize the potential dangers, not as fear, but as actionable awareness, we begin to exercise control over outcomes that might otherwise be left to chance. Understanding the risks of contrast dyes, especially for those living with chronic kidney disease, is not about inducing panic. It is about cultivating vigilance, embracing responsibility, and fostering a mindset that refuses to accept uncertainty as inevitable. Imagine a scenario where a patient steps into a hospital, unaware that their kidney function is already compromised. The physician, bound by expertise but limited by incomplete information, prepares a contrast-enhanced scan that could illuminate critical internal structures yet, simultaneously, threatens to strain fragile kidneys. In that moment, the decision to communicate, to disclose every detail of medical history, to ask the questions that seem mundane but are vital, becomes a matter of profound consequence. We are reminded that life, in all its complexity, is rarely a binary choice of right and wrong, but a spectrum where awareness, timing, and informed action determine the trajectory of outcomes. The lessons that Dr. Mathew R. Weir imparts extend beyond technical understanding. They delve into the philosophy of patient-centered care, the ethics of informed decision-making, and the transformative power of education. This video aims to translate these insights into practical guidance, encouraging viewers to see themselves not as passive recipients of medical procedures, but as active participants in safeguarding their health. The journey begins with questions. How well do you know your kidney function? Do you understand the implications of contrast dyes for your condition? Are you prepared to articulate your medical history with clarity and confidence? Each of these inquiries represents a step toward empowerment, a step toward minimizing preventable harm. It is in the intersection of caution and courage that true wisdom is exercised, and it is here, at the threshold of knowledge, that patients transform uncertainty into preparedness. The stakes may feel invisible, yet they are very real. A single omission, a single assumption, can shift a procedure from a tool of insight to a source of complication. But by embracing the guidance inspired by Dr. Mathew R. Weir, by integrating mindfulness with medical literacy, patients gain an advantage that transcends treatment. The ability to navigate healthcare decisions with foresight, confidence, and a deep respect for the fragility and resilience of their own bodies. Let this be a call to consciousness, a reminder that every scan, every decision, every conversation with a physician is not routine. It is an opportunity to safeguard life itself. As we journey further into understanding the impact of contrast dyes on kidney health, it is essential to confront a reality that many prefer to avoid, a reality filled with uncertainty, risk, and the fragile boundaries that separate safety from harm. Imagine a scenario where everything seems routine. A routine scan, a routine test, a routine decision that feels harmless and necessary. Yet beneath this routine lies an invisible tension, a silent potential for complication that can transform the ordinary into the extraordinary in ways no one anticipates. For patients with chronic kidney disease, this tension is particularly potent, as even a small misstep can ripple through the body, creating consequences that are often preventable, but tragically overlooked. It is in this suspended moment, hovering between reassurance and risk, that the power of clear communication emerges. The physician's expertise, while vast, cannot account for what is unknown. They rely on the transparency, honesty, and courage of the patient to illuminate the hidden truths of their condition. Dr. Mathew R. Weir consistently emphasizes that awareness is not passive. It is an active force, a shield forged through knowledge, diligence, and mindfulness. Understanding the mechanisms of contrast-induced kidney injury, recognizing the early signs of strain, and knowing when to advocate for alternative diagnostic methods can mean the difference between a safe procedure and an unexpected complication. The suspense lies not in fear, but in possibility. The possibility that one conversation, one question, one disclosure can alter the outcome entirely. And yet, many remain silent, assuming that their medical history is obvious, that the healthcare system will inherently protect them, or that the risks are negligible. The truth is that the human body, as resilient as it may be, does not operate on assumptions. Each kidney, each nephron, each delicate filtration unit functions with a precision that demands respect and care. When contrast dyes enter the system without the full context of a patient's health, the repercussions can be subtle yet significant, quietly manifesting in ways that accumulate over time. Herein lies the suspense that is both cautionary and empowering. The knowledge that harm is not inevitable, that injury is preventable, and that the patient's voice is the most powerful tool in navigating these uncertain waters. Consider for a moment the profound responsibility that accompanies knowledge. To know is not enough. One must act, must speak, must ensure that every factor, every medication, every previous procedure, every kidney measurement is communicated with clarity. The philosophical lesson here mirrors a broader truth about life itself. Awareness without action is incomplete. Understanding without application is hollow, and knowledge without courage is wasted potential. Inspired by Dr. Mathew R. Weir, this video seeks to awaken that courage, to transform uncertainty into a strategic approach, and to remind viewers that their health decisions are their own to influence. Suspense is not only a narrative tool, but a reflection of reality, emphasizing that what is invisible can be impactful, that what is overlooked can be critical, and that the stakes, though often hidden, are always present. Patients, caregivers, and even medical professionals benefit when this suspense is acknowledged, not feared, for it becomes a lens through which diligence, preparation, and mindfulness are sharpened. Each detail, each disclosure, each moment of proactive communication compounds into a force of prevention, safeguarding kidneys from avoidable injury. And yet, the deeper lesson extends beyond the medical context. It speaks to a way of living that values awareness, that recognizes the consequences of inaction, and that embraces the philosophy that preparation and knowledge can transform potential crises into manageable challenges. Life, much like health, is an intricate network of interconnected systems, where a single oversight can cascade into multiple difficulties. But the suspense, the tension, the possibility of both harm and prevention serves as a teacher, a reminder that vigilance is not fear but responsibility, that caution is not weakness but wisdom, and that empowerment arises from understanding, reflection, and intentional action. By internalizing the principles inspired by Dr. Mathew R. Weir, viewers learn to navigate not only medical risks, but the larger challenges of life with composure, foresight, and moral clarity. Here, knowledge is alive, suspense is purposeful, and every decision carries the potential to affirm life rather than jeopardize it. Let this awareness settle within you, not as anxiety, but as a guiding force, a compass pointing toward conscious choices, deliberate action, and respect for the delicate systems that sustain us, especially the kidneys, whose silent work deserves our utmost care. As we reach the culmination of this journey into understanding the interplay between contrast dyes and kidney health, it becomes clear that knowledge, awareness, and communication are not just medical tools. They are instruments of empowerment, resilience, and self-respect. The lessons inspired by Dr. Mathew R. Weir remind us that life's most profound wisdom often lies in the details that are easily overlooked, in the questions we hesitate to ask, and in the courage required to advocate for ourselves when it matters most. Imagine a patient entering a medical facility, carrying with them a history of kidney concerns, medications, or prior procedures, and choosing to speak up, to share every relevant piece of information without hesitation. That patient transforms uncertainty into clarity, fear into preparedness, and potential risk into manageable reality. This is the essence of informed participation, where the patient is not merely a passive recipient of care, but an active agent in their own protection. Contrast dyes, while indispensable in revealing hidden conditions and guiding life-saving treatments, are not universally harmless, and the responsibility to mitigate risk rests not solely on the shoulders of medical professionals, but equally on the patient who engages consciously with their health. By understanding the physiology behind kidney function, the potential for contrast-induced injury, and the significance of timing, hydration, and dosage, patients gain insight into the mechanisms that govern their well-being. This understanding fosters a mindset that is both philosophical and practical, embracing the truth that health is not a guarantee, but a responsibility, one that must be navigated with attentiveness, courage, and respect. The suspense we explored earlier, the invisible tension that exists in medical decision-making, is resolved through preparation, vigilance, and proactive communication. By acknowledging the unseen stakes and responding with informed action, patients convert anxiety into agency, transforming a scenario that could have been fraught with risk into an opportunity for safety and growth. Inspired by Dr. Mathew R. Weir, the philosophy extends beyond the mechanics of medical procedures. It encourages a life lived deliberately, a mindset that values awareness over ignorance, action over complacency, and self-advocacy over passive acceptance. Each conversation with a doctor, each disclosure of past health conditions, each thoughtful question asked represents a small but profound step toward autonomy and protection. It is here that philosophy meets practice, where wisdom guides behavior, and where understanding translates into tangible outcomes. The kidneys, delicate yet resilient, exemplify the balance inherent in all living systems, a balance that thrives when attention, respect, and care are applied consistently. Just as one must safeguard these vital organs from unnecessary strain, so too must one guard against negligence in broader aspects of life. The principles of mindfulness, accountability, and informed decision-making are universal, offering lessons applicable not only to healthcare, but to every arena in which consequences emerge from actions or omissions. By internalizing these lessons, viewers can approach their health, their choices, and their responsibilities with a sense of purpose, confidence, and clarity. The empowerment that comes from understanding is both profound and practical. Patients learn to anticipate risks, engage meaningfully with healthcare providers, and make decisions grounded in knowledge rather than assumption. The suspense that once seemed intimidating is reframed as potential energy, a call to deliberate action rather than passive waiting. Through this lens, every scan, every test, every procedure becomes not just a medical necessity, but an opportunity to exercise foresight and responsibility. In conclusion, let this message resonate beyond the immediate topic of contrast dyes and kidney health. Let it remind you that vigilance, awareness, and self-advocacy are not burdens but privileges, not restrictions, but avenues toward a life lived with intention. By applying the teachings inspired by Dr. Mathew R. Weir, you can navigate healthcare challenges with calm determination, transforming uncertainty into clarity and risk into opportunity. Your voice, your questions, and your actions matter immensely in shaping outcomes. And the more prepared and informed you are, the more control you reclaim over your own health journey. Every step toward proactive communication, every detail shared with your physician, every effort made to understand your body's responses and vulnerabilities strengthens your capacity to protect yourself and make empowered choices. Remember, knowledge is most powerful when combined with action, and mindfulness is most transformative when applied consistently. If you're benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early. Let this be your invitation to continue learning, growing, and embracing the responsibility and privilege of informed participation in your own well-being. By doing so, you honor the resilience of your body, the wisdom of your choices, and the inspiration of guides like Dr. Mathew R. Weir, whose teachings illuminate the path toward understanding, vigilance, and lasting health.